Today, Dr. Ted Parran is a celebrated physician dedicating a lifelong career to addiction medicine. But in 1985, Dr. Parran was the chief medical resident at Baltimore City Hospital, where he reluctantly performed medical consults at a newly established detox unit.
I first got interested in the area of working with people with alcohol and drug problems against my will. I was the medical chief resident at Baltimore City Hospital in 1985, and they opened a big detox unit run by a clinical pharmacologist who knew a tremendous amount about drug and alcohol problems but knew nothing about medical problems. And they couldn't find a single living soul in the Department of Medicine at Johns Hopkins or Baltimore City Hospital who for pay was willing to go to the detox unit once a day and do medical consults. So they made me do it. After about 6 months of loudly proclaiming that I was heading for the den of iniquity every day when I went to the detox unit, I'm embarrassed to say, I began to realize that the patients on the detox unit were dressing themselves, and they were making their beds, and they were saying yes please and no thank you to the nurses, and they were acting like patients. And those same people, many of whom were HIV positive at the time, with endocarditis up on the medical and surgical services, were literally throwing urinals at the house staff. And I asked Dr. Jasinski, who ran the detox unit, why did patients with addiction act like patients on his service and act like something other than people on the med-surg services? And he said, because we treat them like patients. We take their withdrawal serious. We try to keep them as comfortable as humanly possible, and we give them the highest quality addiction care. At the same time, we give them the highest quality medical care. And he went on to say that up on the med-surg services here at City Hospital and also the detox unit at Hopkins, you guys provide the best medical and surgical care available on earth, and you ignore their addictions. And they go into withdrawal, and they start to hurt, and you label them as drug-seeking addicts, and you retreat as doctors, and they sign out against medical advice. And he said that's no way to treat a human being. And that really was my first in-my-face introduction to how stigma plays an essential role in the mistreatment, maltreatment, and undertreatment of people with drug and alcohol